Hello and welcome all of you to this issue of Science Magazine.
Namaskar and welcome to this very special broadcast. Many parts of the country have got respite from heat, and of course, Delhi still is sweltering to some extent, but rains are near the corner. Well, as we all know, in India, rains play a very important role, especially where agriculture is concerned. However, there are also certain pitfalls connected with rains. In places where we have heavy rainfall, the spread of vector-borne diseases increases during the rainy season. So to discuss this very important issue, especially diseases like dengue, which occur due to the mosquitoes that breed in rainwater, this is an important aspect that we are going to discuss today. And joining us in the studios is Dr. Rajnikant Srivastava, ICMR Chair for Disease Elimination and formerly Indian Council of Medical Research, Regional Medical Research Center, Gorakhpur, and Head of Policy and Communications at the ICMR headquarters. And also we have with us in our studios Bhavani Maurya, Senior Manager Health Impact Platform AVPN, which is an organization that supports health, climate awareness, gender equality, youth and livelihoods. And I am Kaushik Rai. Thank you both Dr. Rajnikant Srivastava and Bhavani Maurya for sparing your time and joining us in our studios. Dr. Srivastava, if I can begin with you. So if you can tell us what are the key factors contributing to the spread of vector-borne diseases?
Thank you so much, Kaushik. As you know, vector-borne diseases are really major problem of public health, and particularly during the monsoon period, the incidence of vector-borne disease definitely becomes high because we know vectors, they are the mosquitoes, particularly for the malaria, lymphatic filariasis, or the dengue right now. So the temperature, humidity, and rainfall that favors the breeding and proliferation of mosquitoes. And over the years, the incidence of dengue that has increased around the world. And if you just look back into some past, before 1970s, there were only 30 countries they were reporting dengue, and now more than 100 countries they are affected with the dengue. In India, we have also seen the rise of dengue in last several years. In 2010, there were only 28,000 dengue cases being reported in India. Currently, in 2024, there have been more than 230,000 cases across the country. So dengue is spreading like anything. The reasons being that there is urbanization, deforestation, and the water shortage because people are storing waters. Once you store the water, the Aedes mosquito, which is the principal vector for the dengue, it starts breeding. You are having flower pots, you are having coolers. So all these water containers, so this mosquito, it breeds in the fresh water as well as in the domestic water collection. So there is a need to create awareness among the society so they are aware where the mosquito breeds and they can prevent themselves. So recently we have developed certain partnership when we talk about the vector-borne diseases. One single department, when we discuss about the department, health department, definitely they are doing a tremendous amount of work across the country, whether in the rural areas or urban areas. But health alone cannot do the justice. So there is a need to mix all the departments. There is a need to have a multiple partnerships, different departments, whether it is the education department or the PWD department or the other NGOs, private agencies. So if we can work together, definitely we can find good solutions. And recently we have started working with many of the NGOs and the private sector also. And EQ Health Alliance, it is working very good in a way that we are sitting together, we are finding out the solutions, where the interventions are working or not working. But the problem with the dengue is we don't have any drug, we don't have any vaccines right now in India. Though globally there are 2 vaccines available, but in India we have not yet introduced the dengue vaccine. So prevention is only the solution for the dengue management.
And as we all know, you mentioned particularly that in last year 2024 the number was close to 3 lakhs almost in India, and in some cases also there have been fatalities because of this thing. So as a medical professional, Dr. Srivastava, I'd like to know from you, how does a person come to know that he or she has dengue?
So suppose if you are having a fever and a headache and some symptoms, so definitely you need to go for the diagnostic. Currently, there is a NS1 antigen, so you can detect immediately whether you're dengue positive or not. Followed by there are some ELISA tests also, or the molecular testing also. So diagnostics becomes a number one part if you are having a dengue or not. If you are having a dengue, then as we know that you have to take care. It is not going to be severe because 70% of the cases they are not very severe and it can be managed at home only through prevention or having electrolyte balance and everything. But in certain cases when the platelets go down, there is a dengue hemorrhagic fever or dengue shock syndrome. In that case, the patients are needed to be admitted in the hospital. So that is how you have to be very, very aware how your condition is, and you have to be very, very careful while you are suffering through dengue.
This is something, which would be of great benefit to our listeners, that you mentioned platelet count. Many times because of dengue, patients see that there is a fall in platelets. So what is the borderline of safe that patient can be treated, or the platelets not go beyond a certain level?
So it's depend upon patient to patient, but in generally 40,000 platelets are there, so you need not to be worried. But if it is going further down, then definitely you need to consult a medical doctor, practitioner, so that they will take care. The next question with the dengue is that earlier there were only one or two. Dengue there are 4 strains, then 1, 2, 3 and 4. All the 4 strains they are circulating across the country. That is how the dengue becomes very, very problematic in a country like India. So we need a vaccine which can be effective against all the 4 strains.
Since you are from India's apex medical research council, can I ask you, is any work going on in this regard?
Yes, ICMR is working with the Panacea Biotech and the clinical trials are happening, and we are expecting that very soon India will have its own indigenous vaccine for the dengue prevention.
That's something very nice to hear. And Bhavani Maurya, as we talked about, he is with the AVPN, and they are an organization that supports health, climate awareness, gender equality, youth and livelihood. So what can you tell us, Bhavani, about AVPN and its work, especially in the rural areas?
AVPN is Asia's largest social investors network. We are spread across 33 plus markets within Asia and with 600 plus members, which focus on areas such as climate, health, gender equality, youth and livelihoods. And our focus is towards mobilizing resources towards these specific areas, and via our health platform, which I'm part of. And we are honored to have Dr. Rajnikant as part of the EquiHealth Alliance, which we had launched recently in December 2024, where we started this effort of bringing multiple stakeholders together. Because as Dr. Rajnikant mentioned, that there is a need of bringing multiple stakeholders together and multiple cross-departmental coordination to address dengue management and control. And that has been the focus of EquiHealth Alliance, to bring multiple stakeholders, be it from government, which is center, state and local, industry, plus also private sector such as social investors and also civil society organization plus community, together on one platform to discuss about the topic, to understand what are the barriers to address challenges for dengue and develop a common and impactful roadmap, where EquiHealth Alliance focuses on 3 work streams which we are working on, which is prevention, behavioral change, communication and timely management. The second important work stream is data systems and surveillance, and the third important work stream where the entire resource mobilization and financing sits. So in these 3 areas we are extensively working and bringing multiple stakeholders together to then see what are those actionable points or solutions which can be adopted and utilized to then manage dengue.
That is very interesting. And would you like to add anything to it, Dr. Srivastava?
No, I do agree with because you need partnership with all the stakeholders, and that will have some definitely tangible impact.
And what have been the results, since both of you, he's with the ICMR and you are from the private sector, and this private-public partnership, what has been its impact in the areas where you have worked?
So we started this initiative with 2 states, which is Karnataka and Tamil Nadu, but then we did a national launch at World Health Summit's regional meeting, which happened in April in Delhi. And starting our journey from December 2024 till date, there has been a tremendous alignment of various stakeholders from different stakeholder archetypes, be it national programs, be it from the government side, be it from the private sector side, be it from the civil society organization standpoint, and community voices coming in, sharing their experiences and also their knowledge as to how various stakeholders can then gather their knowledge to address issue like dengue.
Dr. Srivastava.
The EquiHealth Alliance conducted these programs in the states like Karnataka, Tamil Nadu, and even in Delhi. Even in Gorakhpur also we conducted many programs on dengue, and we were are interacting with the frontline workers. What are the problems? Because these frontline workers, basically the ASHAs, ANM, they are the bridge between the healthcare providers and the communities. So if the ANM and ASHAs, if they are trained, if they are aware, I think they can take in a better way for the dengue management, for creating awareness among the patients, and the school health awareness, very, very important. And from awareness to the community ownership. So community should take the ownership. Yes, we can do it. If they are aware and they are ready to do that, I think that is going to make a real change in the disease management.
Actually, also in cities like Delhi, where we also have the problem of dengue every year, one thing is that the municipal authorities, they go in for a lot of fogging so that they destroy the mosquitoes, and the wherever they are, the water, at least the mosquitoes don't breed there. So is any kind of this approach also there in the states that you mentioned, or the
So
areas?
you mentioned about the fogging. Fogging gives you a impression, yes, the government is taking some actions and it will have some impact on the
Yes.
dengue. The reality is that the fogging doesn't have any impact on the immature stages of the mosquitoes. The larvae, those who are breeding in the water, fogging will not have any impact on the immature mosquitoes. Fogging will have some impact on the adult mosquitoes. Suppose all the adults, they will knock down today, but fogging is just transient, temporary solution immediately. Suppose what happens, suppose there is a focal outbreak of a disease. In that condition, fogging may have some impact, but on a routine basis, fogging is not a permanent solution.
Okay, so I think both of you would be discussing with the stakeholders to address this issue. And both Dr. Srivastav and Bhavani, I'd like to know from both of you, what are the key linkages between climate change and a disease like dengue?
This is very, very important questions, because there have been some studies which have shown that climate change will have impact on the dengue, and the dengue incidence is rising because earlier we thought that it is a seasonal disease. The maximum of the cases were happening post monsoon, but now you don't predict that when the rains will happen,
Yes.
when they will not happen throughout the year, because it is erratic rainfall.
Yes.
Similarly, the dengue has become from seasonal to a perennial disease. You may have high incidence during the monsoon period, but it doesn't mean that you are not having dengue cases
Yes.
in the pre-monsoon period.
True.
So it has started happening across the years, so that is a big issue. The second important issue is that the dengue is shifting from, there is a paradigm shift, you can say, shifting from urban to rural areas, because the lifestyle is changing in the rural
Yes,
areas. People
absolutely.
have started using the big houses and the permanent buildings, having the water containers and the coolers also. So dengue has also started making roads in the rural areas. That is a cause of worry. So I think there is a need to develop a climate model. If we can have some early warning systems, so you can take some early action, that will help in the dengue prevention.
And Bhavani, would you like to say something?
Dr. Rajnikant rightly said that it's a mix of heat stress and sporadic rain, which is causing enormous amount of rise in dengue cases and the dengue mosquitoes. So when tackling dengue, you need to look at dengue from a vector control standpoint. If there are any solutions from human standpoint, which is say a drug or a vaccination coming up, and also tackling dengue from an infrastructure standpoint, which is infrastructure, be it in rural or in urban or in peri-urban areas, as to where water storage is a critical issue and how you
Absolutely.
can tackle it.
I think this is one point which we all need to focus, because water is something which is very important for all of us. And then storing of water and how to store that, what are the safety measures that people should adopt so that vector-borne diseases like dengue do not should be something which all these stakeholders should take note of. And I'm sure that both of you and other stakeholders will bring out a certain roadmap, if I may use the term, so that the problem of vector-borne diseases, especially dengue, can be controlled. And on that note, I thank Dr. Rajnikant Srivastava, ICMR Chair for Disease Elimination, formerly ICMR Regional Medical Research Center Head, Gorakhpur, and he's the Head of Policy and Communications at ICMR Headquarters, New Delhi, and Bhavani Maurya, Senior Manager of Health Impact Platform, AVPN. Thank you, gentlemen, for joining us in the studios of Akashvani. The program was presented by Dilip Jha. This broadcast came to you from Indraprasth channel of Akashvani, Delhi.